Hello, friends. We're about to start an Insta Live with Dr. Plosker from SGF-Tampa. He is going to be joining us very soon. In the meantime, I hope your day is going well. Christine, thank you for joining us. Dr. Plosker is one of our biggest favorite doctors, reproductive endocrinologists at Shady Grove Fertility in Tampa, and we are waiting for him to get started today. Thank you for joining us. We are going to be starting shortly with Dr. Plosker. Thanks, friends. We are waiting for Dr. Plosker to join us, and we are going to get started with an interview with him. I see he's coming. Dr. Plosker, we see you there. I think there's an opportunity for you to join the conversation. I got this now. Okay. You did it!
Okay, we're here. There you go.
Welcome! We are so glad you're here. We're going to get to chat today, learn all about you. We understand that at Jewish Fertility Foundation, our audience loves to go deep with our doctors and really understand you as a human in addition to a miracle maker. So I'll give you a little bit background for those of you who are joining now. I'm Ilana Frank. I'm the CEO and founder of Jewish Fertility Foundation. We are an organization that serves the Jewish community in three ways, both financially and through mental health, as well as education. So today we're going to talk a little bit about the opportunities in one of our very favorite locations, Jewish Fertility Foundation, Tampa. And I want to make sure that everybody who's on right now is actually following us on Facebook and Instagram at Jewish Fertility Foundation. And we are going to really be able to talk about some of our offerings in addition to going deep with Dr. Plosker. So one of the things that I would like to say before we get started today is that we now are open in Tampa. What does that mean? It means three things. It means we are offering fertility grants, financial assistance of up to $5,000 toward fertility grants, in addition to a 20% discount from our partner fertility clinic. So that's a chunk of change. You can leave our office with significant funds to help you finance your fertility journey. But we also understand that mental health services are really, really important when you're going through this journey. So we offer free support groups, as well as a free fertility buddies peer-to-peer mentorship program, in addition to educational trainings like we're offering today. So enough about this, enough about us. We want to really understand who are some of the doctors that are serving our Tampa friends. So first of all, welcome, Dr. Plosker. Why don't you tell us a little bit about yourself? Who are you?
Who am I? That's a long story. Since I'm 63, there's a lot of me, I guess, over the years. But I'm an REI physician. Um, I started my life in Canada, so I went to undergrad and medical school in Canada, and trained as an OBGYN in Canada as well, and then made my way to California for a couple of years, and that's where I did my REI and fertility fellowship. And then back to Canada for a few years, and I've kind of been a nomad. I moved to the United States permanently way back in '92, and spent 10 years in Massachusetts and Rhode Island. Well, 14 years actually, and then moved to Tampa. We moved to Tampa, my wife and I, in 2006, and we have been here since. So that's us. That's us.
How did you get from a small Canadian boy to becoming interested in this whole fertility space?
Sure. So, long story. But of course, every Jewish boy's mother wants their son to be a doctor. So became a doctor. There was more to it than that. I bought into it. I very much wanted to be a physician myself. And I grew up in a very, very little town in Canada, about 10,000 people in the town. Um, Literally like 4 or 5 Jewish families, and that was it. So one of my role models there was one of the doctors. The Dr. Bringelson was his name, and he was a classic old style family doctor. He delivered babies, he made house calls, he did tonsillectomies, he took out my tonsils when I was 4 years old. He did the whole works. And when I was a medical student, I went back to my town for a few months and worked with him. And so he was my first role model. And then that's how that happened. And then I went off to Southern Ontario near the Toronto area, which was about 1,200 miles away from where I grew up, and got into medical school and became an OBGYN. That's how that whole thing started. And then it's like everything else, right? It's all about role models and positive reinforcement. So the time that I was there was the mid 80s, which was a long time ago. But at that time, IVF was very new. And there were 3 physicians at the medical school I was training at who were interested in starting one of Canada's first IVF programs. And they were just great role models. They were all 3 excellent physicians. They were great people. They were great teachers. And so that probably more than anything is what got me interested in the whole thing. At that point, I'm a very young man. I'm not even married. I don't have a family. I can't anticipate that people might even have difficulties having children. It was the last thing on my mind. I just wanted to get my education going. So the motivation for me was really the role models. And then, life takes you on journeys, right? At that time, some of the best places to train in this were in California. So that got me out to San Francisco for a couple of years. And that's how it all happened. It just has been I've just been very fortunate to have good role models and good opportunities and great places to go and see the world and study.
I love that. I love it. And we always want to know, how did you enter this space? And I think it's an important piece of
Yeah.
the puzzle. So can you tell me what exactly is your favorite thing about being an REI doctor?
Well, my favorite procedure actually is an embryo transfer because it's just the culmination of so much hard work on behalf of the person involved, the couple involved, if it's a couple, the team, myself. So that's the technical thing. But truly the favorite thing about all of this is just the opportunity to help people to have families. I mean, I think for those of us who are blessed to have a family, and even if we don't have our own family yet and we're still working on it and on that journey, we're part of a family. And so I just think that it's so important, and it's just such a life-changing thing, and such a good positive thing that it's, again, just really feel blessed to be able to do something where we can do our best to help. I know it doesn't always work out for everybody. We I kind of hope, I very much hope, even if it doesn't work out, that the woman or the couple that leave at least feel like we did everything we possibly could to help. And I think that will, in that scenario, empowers those folks to move on and look at a different way to have a family if they want.
I think so. And I think, I think that from my personal experience, I also see that. I think that we sometimes look at our REI doctors as, a little touch of godlike. And I think that I even, when I'm sharing with my children who were born through various fertility treatments, the doctor's always part of the story. Yes, I know that there's science. Yes, I know that there are other factors involved, but there is that piece and connection to our doctors that are really part of our children's birth stories. So I appreciate that embryo, the transfer is one of your favorite pieces, and that I think it gives a lot of hope to our audience that there are options, hopefully about what you're doing, but also if it doesn't work out, there are so many other options to building a family. Talk to us a little bit about the procedure when you're sharing, with your new patients, what's going to be happening to your patients. Walk us through from the very beginning. Is the IVF process look like for you?
Okay, so even before the IVF process, right? It's sort of the process of deciding what needs to be done or what the best road to take is. As you mentioned, you've had your children through various different approaches, so I'm
Yep.
guessing not all of them have been IVF or even
All
necessarily
of
any of them.
Any IUIs,
Yep.
medication, to IVF, and then we did an embryo donation.
Oh,
So
which
that's
is great. Yeah, that's a whole different. That's very good. That's awesome.
yeah.
So anyhow, you know, the first thing that I always try to point out, or at least try to set things up in our first visit, is really to try to simplify this, because I think by the time somebody comes to see an REI, they've really been spinning their wheels and probably, unfortunately, in many cases, sent in many different directions, and not really knowing exactly where to go, what to do. And so I really try to simplify it. And really, the whole initial thing kind of boils down, in my opinion, just to a checklist of four things, which is, are you ovulating? Are your fallopian tubes or your anatomy conducive or supportive of getting pregnant? Can the uterus support a pregnancy? And then what's happening with the male partner as far as their sperm quality is concerned. And if you really try to simplify it to those four things, then it gives you a little bit of a grounding for the tests that get ordered and why they're ordered, maybe even some of the limitations of the tests. Not every, medical tests, for whatever the issue is, are never 100% accurate. They're never perfect. But we do that. We drill a little bit deeper, obviously, with regards to ovulation, for example. Are you ovulating? The other questions are, what are we doing as far as egg quantity goes? It's helpful for us to figure out how we're going to give medications and what dose of medications and so on. And then, of course, the $1,000,000 question is egg quality, right? Because that's what really matters ultimately. And so that's the hardest thing to assess. I mean, really, that's almost something you look at in the rearview mirror when you've succeeded and you've got a baby in that uterus. Then we were able to get a good egg, and not until then. So that's the checklist, and that's the first thing I like to go over with everybody. And then, even without knowing exactly what the specifics are for each woman or for each couple, even on that first visit, I think we can give folks an overview of the directions that treatment could go. So really, to me, there's commonly three different treatment approaches. One of them is IUI, or intrauterine insemination. The second, of course, is IVF, which is always the focus of a conversation. But interestingly enough, probably the minority of people actually end up needing IVF, or maybe it's at best 50-50. And then the third potential component, although it's much less common in 2022 than, say, it was in 1992, is occasionally there are surgical procedures that we recommend. not so much as being the final answer, which is how things were back in the 80s and 90s before IVF got really good, but just sort of
Mhm.
as the means of optimizing or enhancing the chances of success. So when we do IUI, the idea there, IUI intrauterine insemination, is that we're going to take your partner's sperm, or if you're using sperm from a sperm bank, that sperm, and place the sperm directly in the uterus. And so if you look at the anatomy, by putting the sperm in the uterus, we're actually getting the sperm probably half of the journey, halfway to where the egg is located at this point in the fallopian tube. Loss of sperm, as ejaculate leaks out of the vagina, or sperm often get trapped in the cervix, the lower part of the uterus. So you bypass all of that. And then what you want to do with that is also, in many instances, or most instances, just a very mild fertility pill as well. And the idea there is, if you think about it, women typically release one egg a month and make one baby at a time, occasionally twins. But by the time you're in a situation where you've been trying for a little while, if we can just get an extra egg or an extra two eggs, we don't want a whole litter, obviously, but an extra one or two eggs with a mild fertility pill like Clomid or Letrozole, we hope we're going to enhance the chances of at least one egg and one sperm fertilizing. So that's IUI.
Okay.
It depends on having open fallopian tubes, because ultimately the sperm still need to get to the egg. And it depends on having not necessarily a completely normal semen analysis or sperm function, but the sperm have to function at a certain level. We can overcome a little bit by doing the insemination. So that's usually the most conservative treatment. And the success rate is actually relatively modest. It's maybe like a 15% pregnancy rate every month of trying.
Can I
Uh,
ask a
yeah.
question? So, do you have within your practice, Shady Grove Fertility in Tampa, like a certain requirement for how many you might go through IUIs before you would get to IVF?
So good question. So it's kind of yes, but ultimately the decision is really driven by the patient herself or themselves, I think. Now, where that comes from, is there are some states, many states actually, I think 13 or 14, maybe a few more at this point, where there's what are called infertility mandates. So, for example, in the northeastern states, Massachusetts, Rhode Island, Connecticut, New York, New Jersey, I think Maryland, Delaware. There's a lot of states up in the Northeast. There's Illinois, I think Hawaii, where if you want to be a health insurance company, the state says you've got to cover fertility. And then the insurance company may have rules. They may say they want you to try 3 IUIs first, or even 6 IUIs first. But from our perspective, we try to just empower people by going over the information and giving them as much information as we can to make that decision on their own.
Got it.
Uh,
Okay.
so there are nuances, right? I mean, if you're 38 or 39, my recommendation would be not to try IUI. If you're financially able to do so, move straight to IVF, because chances are you're going to need IVF anyways. If you're 25 or 26, then you may want to try IUI first. If you succeed on the first or second try, you've saved yourself a lot of money and a lot of complication and
For sure.
all of that. IVF, it's a very safe procedure, but it's not completely harmless, and so all of that has to factor in.
Got it.
Okay, so that's IUI, and you can do that consecutively. So let's say you say to yourself, I'm going to give this a try. I think a better way to look at it is, what are my chances of being pregnant if I'm willing to give this up to 3 tries, let's say. And then let's, in most cases, for somebody who's under the age of 35, let's say, even under age 37, let's say a 1 in 3 chance of being pregnant after up to, if you say I'm going to give this up to 3 tries. If you're still not pregnant, then I think it makes sense at that point to move on and do IVF. Other reasons to go straight to IVF would be blocked fallopian tubes, because that's not going to work, or really a significant, what we call significant male factor, meaning a problem with the sperm. So with in vitro fertilization, it's really a very different strategy. We use much more powerful fertility. goal isn't just to get 1 or 2 or 3 eggs. Our goal is to get as many eggs as we can. And when the eggs are ready, and we tell that we can determine this by ultrasound monitoring and blood testing, it's about a 2-week process. Then we schedule a procedure called an egg retrieval, and that's quick. It's maybe 10 or 15 minutes. You're under IV sedation, so you're very, very comfortable. And during that 10 to 15 minute procedure, using an ultrasound, using an intravaginal ultrasound, we are going to pass what we call a retrieval needle through the vagina into the ovary, and we get the eggs, and we fertilize them with your partner's sperm or with donor sperm that morning, actually, within a matter of hours after getting the eggs. And then we've got this 5 to 6 day process in our embryology lab where we incubate and culture the embryos, and we're looking to develop the embryos to what's called the blastocyst stage. And so what we're looking is probably maybe from 1/3 to 1/2 of all fertilized eggs get to that point. They don't all get to that point. So one of the benefits of the 5 to 6 days of culture is it's going to separate the good embryos from the bad embryos. So we're sitting here watching the Olympics right now. It's a little bit like the Olympics, is that the good embryos, you're watching a hockey tournament, right? The best teams eliminate the worst teams. So by the time you get to that 5 or 6 days, you've got an idea of which embryos really give you a shot at having a baby. And those are the embryos we work with. And so that's IVF. And the success rates with that are very much age related, but you're looking at a completely different expectation. So for somebody under age 35, in general, the chances of being pregnant, if you say to yourself, what if I need up to 3 of these embryo transfers to get pregnant, probably over 80%. Around age 40, it might be closer to 30 to 40% because age starts to kick in. But overall with IVF, you're looking at a treatment that's much more successful, but also much more expensive and much more complex and so on. And so that's kind of it in a nutshell as far as the different overview goes. So the first visit, there's a lot of, well, it could be this, it could be that. These are the steps to take. And then in the follow-up visit, after we've ordered all of our evaluation, we're looking at that checklist of 4, and we're going to look under the rock to check each one. Follow-up visit, which is usually, say, 4 to 6 weeks later. Now we've got some real good information, some individual information on you yourself as the person who's wanting to have the baby. And then we can kind of sit and get into a definite approach or treatment plan. That's usually the way things go.
That's helpful. I think, as some of our Tampa fans, or the folks who are living in Tampa, why would they choose a place like Shady Grove Fertility? Is there anything, you've worked at many places. What is it about your clinic that stands out?
So it's a great place to work and a super successful program. But to give you a little bit of background on Shady Grove, it's the practice is, I think, close to 30 years old at this point, and it's really in very many ways kind of a very sort of heartwarming success story. It started off with our 2 founding doctors who are still practicing, Dr. Sagostin and Dr. Levy up in Rockville, Maryland. So just imagine, like every other little doctor's office back in the 80s and 90s, this nice little office with 2 doctors just kind of doing their thing, and just they were visionary. And so before you knew it, at this point, we've got I think 10 IVF centers in the United States. We've got 1 in Chile. So we've really gone nationwide, and we've done that, I think, by caring and giving people a good shot at getting pregnant, and really being very thoughtful and very compassionate. And so it shows, I think, when we choose who we're going to bring on to the team. It's interesting that I think something like over 50% of all Shady Grove employees actually were at one point patients going through this infertility journey. And I think that speaks volumes for the practice, and just the culture is just, there's an expectation to be excellent, to be caring, to be compassionate, to have systems in place where things work. As far as the doctors that are here in Tampa right now, there's four of us, but I think I tried to get across to you guys that this is really a team sport in many ways. So it's not just us; we're probably the tip of the iceberg. Um, and so the three of us all at one point worked at University of South Florida. So we all had a very, I think, academic perspective on things, and really saw Shady Grove as being an elite place. And our fourth doctor who just joined us is actually Dr. Rachel Sprague, who is the first REI fellow. Fellows are doctors who train to become infertility specialists once they become OBGYNs. So just before Shady Grove came to Tampa, we had established a fellowship program at University of South Florida. And she is actually the first graduating fellow from the combined Shady Grove Fertility USF Fellowship Program. So she just joined us. And I think
Great.
that kind of speaks to where Shady Grove comes from as well, is yes, we're a private practice, and I think that gives us the chance to be innovative, super innovative, which we are, but a practice that also recognizes the importance of science and academic medicine. And this isn't the only place where we have a fellowship with the local or regional university. Up in Rockville, we have a combined fellowship with the NIH. Out in Denver, we have a combined fellowship with University of Colorado. So these, to me, are all things that make this just an ideal place to come and work for. And for me, I came here when I was 60 years old, actually, and just coming here has really given me sort of a prolongation of my career. It's just been a great, I tend to like to mix things up every 10 years or so. I don't fly around every 1 or 2 years, but I like to, do something a little more innovative every decade or so. And this was really a wonderful opportunity for all of us here. So that's the Shady Grove story.
We want job satisfaction for our doctors. So I think that's really, really important
Yeah.
for us looking at places to go. We want to make sure that our doctors have access to the best science and the best research and the best, statistics, good
Yep.
laboratory things that we definitely want to look at as well. Today's been great. I'm really appreciative of your time and just getting to know you a little bit more personally. I'm appreciative that, you shared with us what is involved in the process when we get into your office. I want to remind you, I want to remind all of our Tampa constituents that the Jewish Fertility Foundation is here. Please follow us at Jewish Fertility Foundation on all social media. That's our website as well. We are here to help you. We offer 3 things to the community: financial assistance, but our emotional support and our education, which is free of charge, is open to anybody regardless of religious background. So please continue reaching out to us. And who knows, maybe Dr. Plosker is going to make you very happy in the near future. And thank you so much for your time.
Okay.
And amazing. Any words?
All right. Yeah. May I just a couple of more words is I just
Yeah.
want everybody who's here to, it shouldn't need to be said in 2022, but we aren't just a practice for the traditional kind of, the Goldbergs, let's say. We're not the Goldbergs necessarily. I mean, we are going to look after single folks, same-sex couples of either gender, non-binary. I mean, we're here for everybody who wants to have a family. And, getting back to the personal thing, I mean, just so you know, although I spend my time trying to help people get pregnant with all of our technologies, in our family, our daughter's adopted, our niece is adopted. And so, just always embryos can be adopted. As there's just many different ways to have a family, and we want to help you. I mean, we really want to help you all to go down whichever pathway feels right for you.
Ooh, I love that tidbit of information.
Yeah. Yeah.
Interesting for a future conversation.
Uh-huh.
Sharing that. Amazing. All right. Well, today's Monday, right?
Today
Happy
is
Monday.
Monday. Okay.
And we will talk to you soon.
All right.
Thank you.
Bye now.
Bye-bye.